My name is Marissa Chavis, and I'm doing my presentation on Do Autistic Families Run a Greater Risk for Alcoholism? The article on which I do my presentation on was written by Miles J., Takashi T., Haber A., and Haddon L. Autism is a neurodevelopment disorder that affects 1 in 68 children across the nation. Alcoholism is defined as excessive use of alcohol, tolerance to high amounts of alcohol consumption, and/or negative consequences to family, jobs, or your health. Labasher did a study on 23 autistic children with normal controls and found that 35% of parents deal with alcoholism. DeLong and Dwyer reported that 55% of their 51 autism families had a second degree or first degree relative with alcoholism. Each patient was evaluated by the Autism Center directors using ADI and ADO's protocol, and only those meeting criteria were included into the study. A standard data set was utilized, including prenatal teratogen exposure, perinatal development, language, behavior, health history, including allergies, traumas, medications, dietary, metabolic, neurologic, and family history. Family history was based on semi-structured interviews. In the personal interview, each informant were asked about each first, second, and third degree relatives individually and asked if those individuals had a medical, psychological, psychiatric, or alcohol problem. Questions during those interviews were similar to if anyone in the family was considered an alcoholic. No symptom having individuals were labeled as ineffective. Due to reports of autism in children diagnosed with fetal alcohol syndrome, they needed to be certain that they are not looking for a teratogenic effect of alcohol. Each autism program, and a program is a person who served as a starting point in a genetic study of a family, was examined for fetal alcohol syndrome features, meaning that they looked for microcephaly, excessive fingertip arches, and hirsutism. Each patient was given an IQ score on the most recent comprehensive neuropsychological evaluation. These children were also evaluated by the Autism Center's neuropsychology team and recent results from schools and other centers. When more than one set of test results was available, nonverbal IQ scores were used, with the order of preferred testing being the letter R, the WISC 3, and the Stanford Binet. For younger children, developmental quotients, specifically standard scores, were from the Violin, were used. The 167 families were then separated into two groups based on the pattern of alcoholism in each family. 39% of families' alcoholism followed a pattern consistent with the writer's definition of a genetic trait. High alcohol families had more relatives with affective disorders, also distributed in a familiar pattern. The high alcoholism families did have a significantly higher proportion of affective alcoholic females. The number was 18 times higher than families with low alcoholism families. low alcoholic families. Excuse me, I'm sorry. Also, females in the autism, a certain population were 1.5 times more prone to be alcoholic, and females from high alcohol families were 3.7 times more prone to be alcoholic. I found out that autistic families have a high risk of having a family member with alcoholism. Alcoholism and autism are both highly heritable, but both are heterogeneous disorders that share both biochemical and clinical evidence of some shared genetic causes. Some of the same drugs used in autism and alcoholism, like selective serotonin reuptake inhibitors. This study gave me a lot of useful information about alcoholism and autism families. Thank you.